Patients often ask, what should my expectations be like after facelift surgery? They want to know, what's the recovery time like? What are the day-to-day expectations? When can I go back out in public? And when will I be fully healed? So it's important to understand that there's a difference between downtime and healing time, and I'm going to explain all of that to you now. Immediately after surgery in the post-op recovery area, I'll come out and check up on you to make sure that you're safe and you're comfortable, and to maybe show you some photos on table of the way things looked. You'll be tired and groggy, and you'll be taken from there to an aftercare facility. That night, I'm going to come check up on you to make sure that you're safe and you're comfortable. It's an important place where we have nursing 24/7 to check up on you, to help you get out of bed and to help you get the things you need. You'll be eating regular foods, you'll be walking, you'll be pretty comfortable, or even at that early time point. The next morning, they bring you back to the office where we take down all the dressings and transition you from a big bulky dressing to a much more smaller and form-fitting dressing. This allows you a lot more flexibility, and with a small hoodie, you could be in and out of the office and feel pretty comfortable. And most patients, even though it's noticeable because you're wearing a dressing, most patients feel like they can move easily with what they've got. At around that one-day time point, you're also looking in the mirror, you're a little bit swollen, a little bit bruised, but not what you would expect for most facelift surgeries because of the unique mixture of medications that I use to reduce bruising and to reduce swelling after surgery. Now, every patient has different procedures performed. In most cases, if we're just looking at a face and neck lift, they could be back out in public by the 5 to 7 day time point. What would the expectations be? Well, around 3 to 5 days, you're finishing all the medications, you're feeling much better, you're eating regular diet, you're really feeling pretty comfortable, and you're already seeing a result in terms of the neck and lower face. Around 7 days, you're back in the office. That's a time point when I can remove the sutures from the front and from other areas, such that you could then go out in public, people would see you, and they may know you had something done, but they wouldn't necessarily know what. At that 7 day time point, it's also an important check-in because even though you're feeling much better physically, you're at an emotional low point because you're withdrawing from narcotic, anesthesia, and adrenaline and cortisol that your body formed during surgery. That's when you look in the mirror and say, oh my gosh, what did I do to my body? It's totally normal to feel that way after surgery. But I'll show you photos of before and after. We'll look at the neckline, and at that point, you will actually see a very good difference and be happy with those early results. At around 2 weeks, we see you again in the office to remove sutures from the back. That's a time point when you look at the results early on and say, wow, things are really getting much better. You'll also feel more natural in your body at that time point. Things will still be numb. You'll be done again with all the medications. You'll be moving and feeling more natural. 3 weeks, sensation starts coming back in key areas. That's when you start to feel like you have more control over your body, more control over your face. Most of the swelling is going down, early swelling is going down, and you're really starting to feel, again, much more like things are moving more naturally. Around 4 weeks is when, if you look in the mirror, unless you have a magnifying glass, it's starting to be difficult to see the incisions, and you're starting to get compliments from people telling you that you look well rested, but no one really knows that you've had facial surgery done. Around 6 weeks, you could jump in the pool, back in the gym, working out again more intensively. 3 months is when you're ready for high definition photography or for a wedding. That's when patients are sending me wine and flowers and more patients. Why? Well, because they look in the mirror and they love the result. And truthfully, even at that time point, that's when I say, hey, you look great on the outside, 100% healed on the outside, but the inside's only 50% healed. I may inject you with a little bit of medication to modulate wound healing, scar tissue formation. We may be utilizing a laser or another energy-based device to further improve the quality of your results. I may be utilizing neuromodulator in order to do some subtle fine tweaks of things in order to improve not just the quality of the scar or the incision that's there, but also to improve the quality of the overall result of your facial rejuvenation. Around 6 months, you're more like 60% healed. At 1 year, you're 70 to 75% healed on the inside. 2 years, closer to 90 to 95% healed. That's why I say healing is different than downtime. There are all the things that you don't even notice, but when I see you in the office at our 1 year checkup, I'll say, oh yeah, there's a little bit of massage that needs to be done here additionally, or let me inject you with a little bit of this scar modulating medication in order to help soften things and make it more natural. Again, surgery with me isn't just surgery and see you later. You're gonna see me again routinely at that 1 week time point, 4 to 6 weeks, 3 months, 6 months, 1 year. It's not a process of, it's not a quick process. It's not a process of fast turnaround. It's back at work within a week or maybe 10 days, but the long-term healing journey takes quite some time, and that's important to understand if you're undergoing any facial surgery. So again, these are the expectations that you should have going into facelift surgery, and I think most patients are actually pretty surprised at how quick they're able to get back to their day-to-day life, and they're definitely happy with the quality of the results early on, and I think that that's what differentiates my practice from others.